The Trump administration just cut $259 million in Medicaid funding to Minnesota, and over 500,000 kids are about to lose their health care because of it. And as far as the stated reason, it's fraud, but the closer you look at who's being targeted and why, the harder it gets to take that explanation at face value. Right, so yesterday, Vice President J.D. Vance and CMS Administrator Dr. Oz announced the funding freeze.
We have decided to temporarily halt certain amounts of Medicaid funding that are going to the state of Minnesota in order to ensure that the state of Minnesota takes its obligations seriously to be good stewards of the American people's tax money.
And certain amounts meaning $259 million. Right, Minnesota's Medicaid and Minnesota Care programs, they serve nearly 1.3 million people, roughly 1 in 4 Minnesotans. And about 2/3 of those enrollees are parents, children, and pregnant women. And this also comes as there's a 6-month national moratorium on federal funding for durable medical equipment, including prosthetics and orthotics. So this isn't like a surgical strike at fraud. This is a sledgehammer to healthcare access for an entire state. Now with all this, is there a fraud problem in Minnesota? Yes, that part is real, and it is serious enough that it contributed to Governor Walz dropping his campaign for re-election. Walz himself even acknowledged it, saying that the state had made systemic changes to the way we do business and that the government can't effectively deliver programs without earning public trust. And the fraud typically looks like individuals or businesses billing state agencies for social services, think childcare, nutrition programs, housing, without ever actually providing them.
Far too many people have gotten rich by taking what is the best of the American spirit and getting rich off of it instead of providing services to kids who need it. That is stopping today.
And there is a legitimate structural issue. Federal dollars were flowing into Minnesota-run programs with little verification that services were being delivered.
You have people who are billing the government millions, tens of millions, billions of dollars saying that they're providing a service, but there's no actual confirmation. There's no follow-up to ensure that they're actually providing those services. We want to see that follow-up from Minnesota.
And with all this, you had Dr. Oz saying they sent a letter to Governor Walz back on December 7th asking for a corrective action plan and found his response inadequate, with Vance also laying out what they want going forward. So that's the official framing, but here's where it starts to unravel. Because this conversation, it blew up a few months ago when conservative YouTuber Nick Shirley posted a video questioning daycare workers in Minnesota.
Where are the children at? Do you know where the children are at? Where are the children at in these daycare centers?
I don't care.
Are there children here today?
No.
No children.
Yes.
So that video goes viral. You have Vance and Kash Patel amplifying it. You have Trump claiming that he sent ICE to the state to investigate a fraud issue, with DHS calling Minnesota ground zero for the war on fraud. And from the start, the Trump administration pointed fingers at Minnesota's Somali community.
Members of the Somali community have pillaged an estimated $19 billion from the American taxpayer. Oh, we have all the information. And in actuality, the number is much higher than that.
So that number ends up actually being wildly inflated. What reports actually show is that officials found roughly half of the $18 billion in federal funds supporting 14 Minnesota programs starting in 2018 may have been stolen. And even if every dollar of that were attributed to Somali Americans, which it shouldn't be, half of $18 billion is not $19 billion. And of the 92 defendants across the child nutrition, housing, and autism program fraud cases, 82 were Somali Americans, right? So that is the real number. That is not a disproportionate number, but 82 people, not an entire community. Yet this, it's how the president talks about it.
Somalians ripped off that state for billions of dollars, and they contribute nothing. I don't want them in our country, I'll be honest with you.
Minnesota has at least 80,000 Somali residents, the vast majority of which are U.S.-born or naturalized citizens. And reports show that the fraud cases have damaged the community's reputation and created new rifts, layering suspicion onto an entire population that was building real economic and political standing. And among them, you have leaders like Ilhan Omar. Right, and with all this, Dr. Oz's own language during the announcement, it didn't exactly help.
This is not about the money by itself. This is about people's lives and our culture, our shared values that have allowed these beautiful programs, Medicare and Medicaid, to survive brilliantly for 60 years.
Right, you had many saying that was just one of many dog whistles, saying that it's hard to see how culture and shared values are apparently relevant to a healthcare funding dispute, unless that is the dispute's really not about funding. And so that's the tension running through this entire story. There is a fraud problem. Again, I'll repeat that. There is a fraud problem. But this administration, it has a track record of using real problems as cover for other agendas. Trump's personally pardoned or commuted sentences for people who have committed actual fraud. Julian Todd Chrisley, Michelle Fiore, Michael Grimm. So a deep personal commitment to fighting fraud, that doesn't track. Meanwhile, ICE operations in Minnesota have led to what many community members have described as unjust attacks on the Somali population.
We reject the lies against the Somali communities and the attacks on our families, and we demand not only ICE out, but the state repair the damage that has been done.
And you've had Governor Walz being very vocal, posting that Trump is weaponizing the entirety of the federal government to punish blue states like Minnesota, and saying these cuts will be devastating for veterans, families with young kids, folks with disabilities, and working people across our state. And in case you're wondering why this matters, right now, over 1 million Minnesotans, they're wondering how they're going to receive health care. You've got Dr. Oz giving Walz 60 days to submit another corrective action plan. And if the response isn't satisfactory, the state could face even deeper withholdings. The fraud is real. It should be addressed, but stripping healthcare from hundreds of thousands of kids, parents, and disabled Minnesotans, it's not fraud prevention. It is collective punishment. And when you have a president who is on record saying that he doesn't want Somali Americans in the country, it is very fair to ask whether cleaning up Medicaid is actually the goal or it's just the excuse.